Hi YouTube, this is Dawn. I'm coming to you with yet another video. Um, I am so super excited about receiving my surgery date until I just can't stay off YouTube. Um, I had something that I wanted to share with you guys. I don't know if you guys remembered me saying yesterday that, I was feeling an array of emotions, that I was excited, that, I was anxious, and that I was afraid. Um, I'm excited because I know that it's going to be a change for the better for me, health wise, for my family, for my children. Um, I'm anxious because who wouldn't be anxious? It's a major surgery. Um, there's a lot of changes to be expected with having this surgery. So I think that being anxious is probably a normal emotion to feel when it comes to having any type of major surgery, not just weight loss surgery, just any type of major surgery. Um, then I said that I was scared. Um, I'm afraid because of all the risks that are involved. I am trying to stay prayed up. Um, I think the scariest part for me is the fact that in 2004, I lost my sister. My sister actually had weight loss surgery maybe a year and a half prior to passing away. Now, she had her surgery in two separate parts. The first part is where they went in and they um, divided her stomach. And then the second part, which was approximately a year later, they went in and they did the rerouting of her bowels. Well, after she had the surgery, of course, she had to be placed on birth control pills, and then we had a very long trip that we had to take to New Jersey, which required us to ride for about 10 hours, 10 or 11 hours. And we were going to my grandmother's funeral. Well, my grandmother was buried on that Saturday, which was September 25th. As soon as we got home the following day, which was Sunday evening, we got home maybe around 5 p.m. By 6 p.m., my sister had passed away, and she passed away from a blood clot. Well, I don't think that it was actually the surgery per se that caused the blood clot. I think it was the long ride and, her not getting out to move about um, like the rest of us did. And also the fact that she was on the birth control pills, which was something that, she hadn't regularly taken. Um, I think her being out of surgery for over a year and a half, I think the risk of the blood clots forming had pretty much subsided, by then. And, all of the doctors that I have spoken with stated that it was probably due to the the birth control pills and the long ride that we took. And I actually went to a hematologist myself, and there are no hereditary factors whatsoever that I have that would cause me to develop a blood clot. Not saying that it wouldn't happen, but from the hematologist's perspective, that's something that I'm not prone to having, I guess I would say. But of course, we know with abdominal surgery that, you know, the risk is increased. Um, so I think that's what's giving me, that's the part that's making me a little afraid of having the surgery. Um, it's still really hard for me to um, cope with what happened to my sister because it was so sudden. And, of course, she was so young. And, we were very close. We were only like 18 months apart. And, it was just the two of us, just us two girls. I have a half brother that lives in Jersey, but, it's nothing like a sisterly bond, I guess I would say. But in any case, I just wanted to share those feelings with you guys. Um, I think when it comes to this, I really could use some words of encouragement, because it's kind of a bittersweet situation, a very bittersweet situation. Yeah, I don't want to be afraid to have this surgery. I know that many people have reservations about it, but I don't want to be afraid because of, what happened to my sister. If there's any fear there, I want it to be, you know, just fear because of the complications itself, or the possible complications that may arise. I don't want to spend my life in fear. When she had the surgery initially, when she had the first surgery initially, we were supposed to have the surgery together. And I ended up getting pregnant. So, of course, I couldn't have it done, and she went on and had it done. And I know that there has been a lot of changes since she had her surgery, and I also know that, they are a little more cautious now than they were back then when it comes to medical clearance, uh, medical clearances for having the surgery. They want you to have your psych evaluation, along with cardiac clearance. Um, for me, of course, the clearance from the hematologist, also the my clearance from the ear, nose, and throat doctor. Um, Clearance from my primary care physician. So, it's a number of things that, you have to be um, cleared for in order to have this surgery, and which is a good thing. It's a really good thing. But I just ask that you guys just, once again, keep me in your prayers, and just pray that I can just let go and let God, because I know that, God takes care of his children. And I know that I am a child of God. Um, but sometimes we let we let our minds run wild with us, and I just want to, be at ease, and know that, God is going to see me through this. I really honestly believe that he is going to see me through it, because he knows that I have these two little girls that I have to take care of. Um, so just pray for me that, that I'll be strong, and just do what I need to do in order to get to the next level with this. I'm still pushing. I'm not giving up, but just having a few um sour moments, I guess. But I'm still excited, through it all. I'm still excited and just ready to do this. Um, so if anybody else out there is feeling what I am feeling, please comment. Just, leave me some words of encouragement, or, what have you. Just somebody tell me what I need to do um, to stop my mind from wandering all over the place. But in any case, I just wanted to come to you guys and share that with you. I wanted to open up to you about the loss of my sister, and, you know, how it has affected me thus far, and how it makes me feel some kind of way about, you know, any and all surgeries. But in any case, I just needed to talk, guys, and I appreciate you listening. Um, I love you, YouTube, and I appreciate your support, your advice. I appreciate it all. I mean, I really and honestly, I truly do. Um, because it's a lot of times it's not that easy to speak with family members, or people that you're acquainted with, people that you see all the time. A lot of people don't understand because they're not going through what we are going through. We meaning us, those who are in the weight loss community, and those who have experienced the same feelings and emotions, and the surgery, you know, uh, just different feelings after having the surgery, different emotions before having the surgery. So I just really love you guys, and I thank you so much for supporting me, and sending me your well wishes and all. But in any case, I'm going to let you guys know. It looks like I'm at about 12 minutes, um 12 minutes and 36 seconds. But I will talk to you guys soon. Love you very much. If you would rate, comment, subscribe, that would be great. And anytime you leave a message, I promise you I will definitely respond. So you guys have a lovely evening and have a blessed day.